Who's making really cute robots that make burnout from physicians a lot less likely? It's Dr. Mohamed Alarakhia. My name is Jeff. I am the host of this podcast, MedTech Talks, which is under How It's Med. Today, our guest, as I just mentioned, is Dr. Mohamed Alarakhia. How are you doing, Mohamed?
Other than having a ton of snow
how much
outside,
snow is
I'm
it?
doing
Because
great, Jeff.
Vancouver snow that hampers everything is like at least an inch. What is your snow? Your definition? Okay.
It's about 4 inches. So and that's not too
All
bad here
right.
because
Okay.
I think we're
Well,
used to it.
with the snow and all, has that been hampering, I guess, the sheer amount of work that you're doing? Because I mean, we've chatted before this podcast off the air. Um, have you been like, how's everything been going?
Yeah,
Yeah.
well, I think thank God for virtual care, right? Because you can still follow up with patients using virtual care, and we're going to talk about robots. Robots don't care if it's snow or not because they're virtual and they can keep on doing their work. They show up to work every day. So I think that work is ticking along. And with the pandemic and snow days and stuff, I think
Yeah.
it is challenging. I think on a personal level with sort of managing that, but. I think we're managing, and we're looking at the light at the end of the tunnel and getting back to
See,
some
robots and
semblance of
medicine just
normalcy.
reminds me either of Star Wars or Skynet. But I think you're the one to correct me on that stark dichotomy. So, let's just dive into it. Why did you go into medicine? I think that's perhaps a good way to, set the story.
Yeah, I mean, I think it started with my grandma. Really, my grandmother was with us, and she raised my dad and seven other kids alone because my grandfather passed away when his kids were quite young, and so she was a matriarch of the house. She lived with us, and she got tremendous care from her family physician. Her family physician would come home and look after her and was always there. And I remember vividly when she wasn't doing so well, he came home and did a home visit and called the ambulance and then accompanied her to the hospital. And so that really just it showed me what care was about, how that relationship was so key. She trusted him and listened to him, even though she wouldn't
Fair
sometimes
enough.
listen to us on certain things. She really did appreciate his advice. And she wouldn't go to the hospital, but when he told her that she needed to go to the hospital, then she followed through on that. And so I really saw that the role of a clinician in someone's care was clear. And I think I've tied a lot of things to that experience because it really is about allowing clinicians to care for patients and have that relationship. And there are a lot of things that get in the way. And so some of the work that I've been doing is to get those things out of the way and go back to where
hmm
that
So it seems
relationship
like
is the most
that
important thing.
relationship between the patient and physician really stands out to you, but you seem to have gone into the med tech route to some degree. I guess how did that begin? I remember off the air you talked a little bit about having a background in compsci, was it?
Yeah, I did my undergrad in biochemistry, and then I also did a bunch of compsci courses in mathematics. And so it's always been my interest that, when I was choosing what program to do, it was either computer engineering or biochemistry, and I chose biochemistry. But did make sure the computer piece was in there. It's always been sort of an interest of mine. And so as I, went through different, studies and sort of got into medical school, it was something that I, kept with me and did research in digital health and ensured that I sort of stayed grounded in that. I saw the opportunity to make things better by continuing to leverage technology, recognizing as well you have to do it right to make things better. That there are also challenges that we've introduced on clinicians because of technology. So it sort of stayed with me in terms of that interest and passion in doing things in the medtech space and
So,
that's
Mohammed,
why
I
I'm
don't
where I
mean
am
to
today.
date you, but back when you were going through the whole med tech scene, what did digital health look like? Because I think that setting that scene would allow us to go through time together a lot more smoothly.
For sure. So when
Stone
dinosaur
tablets, right?
roamed the earth, no, that's right, that's right. We had tablets at least, right? At that point in time, and they made a comeback pre-COVID into clinics. But it really was, in terms of patient health. So my research project in medical school was on
Mhm.
health information on the internet, and it was just sort of starting in terms of having information available for patients, and there was a lot of work on, well, is it accurate information, and should patients sort of rely on it? There wasn't a Google to go and easily search for things at that point. And so, there was, work on looking at, approving websites and making sure they had appropriate information at that time.
Mhm.
And, that's still relevant today, but very much, email had just sort of started up in its sort of infancy, and communication electronically had just started up. And so, it was just, I think we were recognizing that there was some potential here, but I think it was more about the dangers, right? What is like, oh, people are going to go online and look at information that would be, and I wouldn't, in my research at that time, about 30% of it was accurate. And so, they're going to look at information that's not accurate, and then go talk to their provider, and what harms can that cause? And I think we
Mhm.
flip things on its head right
Yeah.
now, I hope, but there's still some of those concerns, right? So some of these things are
Yeah.
maybe timeless, as a way to put it, in terms of some of the
Yeah,
cautions
that's very do no
that are out
harm
there.
of you, looking at the dangers first instead of the benefits first. But what are some of the benefits that you saw of, I guess, what was digital health back then, in terms of patients being more informed, et cetera?
Yeah, and so in my residency, I carried on
Yeah.
that work from a patient-facing perspective, and did a study on a patient portal, actually for diabetes. And diabetes patients were entering information online, their blood glucose, their blood pressure, the amount of exercise, and so it was, it seemed very empowering to them. And we actually did a control group study where we looked at patients that didn't have access to this technology and weren't doing that, and we saw benefits in terms of their blood glucose control, and satisfaction. And so I think what I saw at that time was that there was an opportunity to help patients self-manage their care, help clinicians get the information. So when you see a patient for a diabetic visit, you want to review their sugars, you want to ask them how they're doing. Well, if you're capturing that in between visits through a portal, then you're able to actually have a more informed conversation at the time, and understand why things may not be so good because of challenges with, getting access to food, and, food insecurity or other stressors in their life, because they could document all of that in the portal. So, that really showed me, there is another side to this. There are opportunities here where we can work as more of a collaborative partnership between, clinicians and patients, where we can sort of move some of these things forward in between appointments, right? When you're not sort of connected to the patient, you sort of both lose each other a little bit, and then when you try to come back in a short time, you're trying to fill each other in on what's happening and what your thoughts are, and you don't have enough time. So this
Mhm.
really took that dimension away, and you're able to, at least capture information in
That's
between
really fascinating because you said
appointments.
to me at the beginning of this podcast that it's the patient-physician interaction that's really important to you. But it seems like instead of making care more impersonal by using technology, you've made it, to some degree, much more personal by your focus on MedTech between visits, or digital health visits, or interactions between visits.
Yeah, that's exactly
Hmm.
what we need to do intentionally, though. Like, I think it can become more impersonal if someone just sort of goes on to a virtual walk-in clinic, as an example. That can be challenging, right? You don't know the provider for
Yeah.
certain things like chronic disease management. There's a lot of catch up to do in terms of what's going on, and so I think we have to understand that there are some risks with that, but that used appropriately. And again, this is about clinicians and patients
Hmm.
actually co-designing this, working together on moving this forward, that, you can make things better. You can actually facilitate interactions. For example, when patients come to my office, before they come, we send them questionnaires where they're able to fill in information, and it goes right into the medical record. And so that actually makes the appointment a lot more efficient. We're able to focus on some of the important things, able to sort of talk about and allay sort of any sort of concerns around any issues. And so, if you do it right, you can actually sort of um, have a better relationship, despite, I think some of the fears about
Hmm.
technology
So,
actually
I mean,
causing the
that
opposite.
clinical trial seems to have been a pivotal experience for you in terms of bringing together your different areas of interest and passion. But what were some of the hardest parts or the tougher stories that you had coming out of that clinical trial? Because clinical trials aren't trivial at all to manage.
Yeah, absolutely. So like, I think, it was a group, and I was very fortunate to have a great group of other residents with me sort of working on this. We were sort of slaving away. We were sort of known as the group that would be sort of staying behind and getting, analyzing the data, following up with patients, making sure that, we had sort of people engaged, and so it was a lot of work. I do think in the digital health realm, we need to do more of that. Like, I think we see lots of things that can be successful, but
Hmm.
are they actually successful, right? So a lot of talk about artificial intelligence now and how it can help with care, and lots of things about, automatically triaging patients. Does that help? Right? I think we need to sort of understand that. We need to do the right studies to understand, are things working or not? Not to say that we shouldn't innovate and try things and move things forward. I think we need to do that, but also understand what the role is, because things can make care worse, and so we just need to be aware of that, and we need to be proactive in understanding the role that technology has in
So you're
the
carrying out
delivery of care.
I guess, an instance of health tech assessment, and that must have been something that I guess you worked really hard to do well. But how did all this experience carry over into your founding? Did you found the eHealth Center of Excellence? There you go. Okay, so
I
how
did.
did your experience carry over into the founding of that organization? And like, what were the specific ties?
Yeah, so it's a not-for-profit organization that's a delivery partner in the health system that really helps clinicians use technology to help to support patient care. When I went into it, I had lots of scars from the different work that I had done before in terms of
Scars.
knowing what doesn't work, knowing that, yeah. I mean, I like, the majority of health technology um, initiatives in healthcare fail because clinicians don't adopt the technology, because patients have trouble accessing the technology, and so learning from that, and between residency and starting the organization, we did a ton of other initiatives. I was participating in a lot of other initiatives, that were sort of national projects, provincial projects, and local projects, and it just let me know that you have to do things in a very careful manner. So you need to really look at um, understanding, um, what are the implications of each of these things? How are patients and providers impacted? And then go about carefully. So, founding the Health Center of Excellence has been something that we've used that philosophy to test things out, do proof of concepts before we sort of launch things full scale, make sure that we understand how things are going to interact with the rest of the healthcare system, what some of the unintended consequences are, what some of the benefits are. And then once we understand that, then we're able to scale and spread things in a way that supports, clinician workflow. So that's been really important. And so, I've taken direct learnings from my previous, um, you know, exploits or initiatives and put it into the work that we do today.
So, Mohammed, it seems like that work with that clinical trial really was, I guess, trendsetting in terms of doing health tech assessment for digital health and involving patients overall consistently between visits. But how did this all tie into your work with the eHealth Center of Excellence? You founded that, right?
That's right. That's right. Yeah, in 2014, I founded the Health Center of Excellence. I think after experiencing a lot more things as well, and having sort of a lot of scars from those
Yeah.
different initiatives, the majority of MedTech initiatives fail because there's different challenges in terms of different sort of barriers to get into the healthcare space. Adoption is always something that's really important. How do clinicians adopt a technology? How do patients adopt a technology? And so, I learned a lot from participating in different initiatives at the national, provincial, and local level. And that really led me to found the Health Center of Excellence as a way to understand what works in the clinical workflow. How do patients and providers actually interact in the healthcare system, and what type of technology would be valuable, and establish really an approach to test things out before we scaled and spread. So we do proof of concepts to understand how something would work in the healthcare space, and then once successful, we scale and spread them. It's about understanding what the value is of what we're trying to do, and then moving forward. So we don't rush into things.
Yeah.
At the same time, we know there's tremendous opportunity. So we highlight the opportunities that are there, and then we look to pursue things that can help that patient provider interaction.
You said the majority of health tech startups fail. Do you have a ballpark number?
Yeah, and maybe just to clarify, health tech
Health tech
initiatives,
initiatives. There
right?
you go.
So
Okay.
initiatives, yeah. So projects that are done, I think it's a fairly high percentage. And don't quote me on this, but like up to
That's
80%.
wild.
It is, and the reason is, success really is about incorporating them into regular workflow, so that people are using them routinely, that there is a high active
Mhm.
use rate. And so we know that, even with virtual care, like look at virtual care before the pandemic, and it wasn't used. It's been around for a long time, but it wasn't used to any significant degree. With the pandemic, it's really taken off, but now it's started to fall off again,
Mhm.
right? So we went from like single digit percentages, like 8% in the system, to like 90% in the system, and now it's sort of down to like down to 60% or so. So significant drops in usage, and so I think we really have to be careful about how we put these things forward and have the right supports in the system to make them successful.
I'm going to go a little bit off track here, then I'll come back to your work with the eHealth Center of Excellence. But I mean, you've got a perfect background in terms of work with compsci, as well as being a clinician, and then a clinical trial that looked at how patients interact with and benefit from digital health support between visits. So why not go into the startup world, and why focus on building the eHealth Center of Excellence?
Yeah, I think it's the startup world is very appealing. I think that there is tremendous opportunity. Lots of great startups that are making sort of huge gains and really helping us move things forward. To me, I saw the missing piece was the clinical voice within the healthcare system, advocating for the use of technology, and really putting that sort of lens on, we need to support the patient provider relationship, and how do we do that in the
Hmm.
right way. And so I got into leadership within the healthcare system sort of early on, through what's called the LIN, the Local Health Integration Network, which is like a regional health authority structure in Ontario, and then went into Ontario Health as well. And through that, really saw that there was a role for clinicians to communicate about what the needs were, about what the challenges were with moving forward in the digitization of the healthcare system, because everyone wants to do it, right? Everyone talks about digitizing the healthcare system, how it's a good thing, but we need to have the right processes and the right input in doing that. There are more physicians and other clinicians needed to be leaders in this space to really guide the implementation. So it's not a technology first implementation; it's really a clinician guided implementation of technology. And so I think that was a gap that I saw. And as I sort of went into it, there was an opportunity to say, we're going to work with clinicians to leverage technology that makes sense. And the Health Center of Excellence does that. It's a not-for-profit organization that really works on the front lines with clinicians to say, how do you serve patients better? How do you help improve access to patient care? And that might be virtual visits. It might be, online questionnaires. It might be, having a backend process simpler in terms of the documentation in the chart, so that they can spend more time with patients. But it's understanding that
Hmm.
first, right? And so that was what was appealing to me, is really just understanding all the workflow challenges, and then bringing different technologies that startups and other companies make to bear on those challenges. So that was an area that was, very interesting to me. I did a master's in health information science after finishing residency, and that just opened my eyes to, how health systems are designed and how clinicians work within them and what the opportunity was for technology.
So you saw the need for technology to be assessed for its merits in terms of helping or helping physicians help patients. But how much of the process of what you do at the eHealth Center of Excellence is actually getting the tech into the hands of physicians? Because I understand that that in itself is a hard process as well, at least in Canada.
Yeah, that is the majority of what
Okay.
we do. I mean, we look at, we do procurements on behalf of government where we put things out to look at, what we look at a problem first, like what is the problem that we need to solve? An example would be like messaging between providers. How do you support communication between clinical teams? And then you would go out to the field and really look at, well, what's out there? What are the different things out there? And I think it's really important for us to do it in a way that startups are part of that, right? Often they are not part of these procurements because they're extremely complex and they don't have the capability to do that. So when we've done procurements, we've made sure that we included the startup community in it, got their feedback, and made it easy for them to participate while meeting the criteria and the requirements. And I think it's yielded great results. And we've been able, therefore, to launch and do some projects which, we've had startups participate who've been really nimble and really able to meet the needs of clinicians. So I think that's an area too where there's more work to be done and a greater opportunity. Startups often go, unfortunately, south of the
Yeah.
border with what they do, and we need more of them to help our own healthcare system.
So you mentioned a little there as to why you involve startups early in the process of solving problems so that they in themselves can find a good product market fit. But in really simple words, can you identify the specific issues that make procurement so difficult in Canada, or at least in your experience?
Yeah, so it's often like when typical procurements are put out, there's like 3,000 requirements for a procurement that are put out. And you think about a startup that's trying to solve a
Wait,
problem,
is
trying
3,000
to
exaggeration or is it actually 3,000?
for different systems it is 3,000. Yeah. Yeah. So, and those are more complex systems, but even for more simple things, like, there are so many requirements that technology companies have to meet, and there's a criteria around how much sort of financial stability the companies have. It's a long process to go through procurements. It could take like 9 months. And if you think about a startup and the capability, like they're just trying to develop
Yeah.
a product, they're trying to get some things out to market, they're trying to test things out and iterate. Spending 9 months in a process to just try to get the foot in the door is not a priority. And so, we have made it hard for the startup community to participate. And so there are ways around this. There's something called an innovation procurement approach where you are really looking at essentially forming a partnership with the successful company to develop a product over time. You're really looking at outcomes. I want to improve wait times for patients. You're not saying I need a system that does X, Y, and Z, right? It needs to like transition data here to there. It needs to have, a messaging piece built in. It needs to have, this data piece built in. You're saying, I have to solve this problem, wait times. And you put that out there and say, who is the best to solve that? What are the creative ideas that you have to actually solve that? And, what do you have right now that we can leverage and how do we develop that over time? And then you go through the procurement steps, the similar steps to what you would typically do. But at the end of the day, you form a partnership with the vendor where you are collectively solving a problem together, and where the product will evolve over time to meet a complex healthcare problem. We know actually for a lot of complex problems, there's no one technology that can do it all. And so this is a process by which over time you will have technology or technologies that solve multiple
hmm
problems.
So to place this in an analogous context, I'm going to simplify a little. Correct me if I'm wrong. So say we'll draw
Mhm.
the analogy between physicians' offices and, for example, an office that wants to order pizzas. So essentially, what you're doing is with procurement, you're putting the call out there for different stores to make the pizza the way that you want it. And you're essentially trying to figure out which one is the best match, which you'll keep buying pizzas from for your office, correct?
Yeah, I think that's a great way to do it. Or you want a delivery service, and people will deliver things in different ways, right? Someone might say, we're going to deliver with a drone. Other people will have, um, drivers on hire. Others will have a regular service that comes. And so people can propose different ways with getting the pizza to your office, and then you would pick the one that that meets the criteria of getting the pizza in a timely way with the right toppings, to your door. So yeah, that's exactly it. And so instead of saying, we need, this type of driver and this type of box and this type, you're actually just saying, I need a pizza, and can you deliver it to me?
Yeah, that's fair enough. So what is your favorite kind of pizza?
I like sort of vegetarian sort of toppings. So I would just sort of say more of a vegetarian pizza, and I don't mind. I know this is controversial, but pineapple as well, a Hawaiian pizza. So I know. Probably we don't need to go down that rabbit hole, but it is a Canadian invention, actually, right?
It is.
It is.
Wow. That's kind of weird. Hawaiian pizza Canadian. Anyway,
Right.
so you do also some other really interesting things at the eHealth Center of Excellence, such as making bots that I mentioned previously at the intro to this episode. So tell me more about that work and how that came about.
Yeah, it really came about because clinicians were burning out. And we know that even before the pandemic, it was an epidemic, right? Where clinicians were burning out, people were leaving practice, retiring early, having significant issues with, maintaining their practices. And so, we had to find a way to help out. And when you look at what clinicians sort of go through, there's a lot of administrative processes. 40% of time or more is taken up on just administrative work. And looking at other industries, they've been able to figure out ways to do that, ways to automate certain things, to reduce the administrative burden. And so that really spurred me to say, we can do that in healthcare too. Like there are a lot of repetitive routine processes that we do that are not value add for patient care. So can we do something to sort this out? And, there's a lot going on about automation, artificial intelligence in the environment. And so really understanding that there are some opportunities there. Other industries, insurance, aviation have used automation to help with the process. When you go to check in for your flight, that a lot of that's automation software that's actually figuring it out and processing that. And in the aviation industry has found out how to communicate between disparate systems and disparate airlines and things. And so, in healthcare, we have an opportunity to leverage the same technology.
Mhm.
So, we did similar with, what I said before is we did a proof of concept to really look at bots. So these are software programs, repetitive routine, that do repetitive routine processes. They're not walking, talking bots, but programs that, software programs that work 24/7. They don't take coffee breaks. They don't complain unless you want them to. And so we deployed some bots to really help with a few different things like sharing of information between systems and improving data so that electronic medical records can use the data for reminding patients or tracking patients. And we saw that there was tremendous value in that. It supported clinicians in their workflow. They took on some of the burden that clinicians had. And so we started with that, and now we have a bot family, really, that's doing a number of tasks for clinicians.
Okay, but here's a real kicker. Tell us about the names of those bots and their functions.
Yeah. So this is the fun part. Yeah. So, why not have fun when you're doing this work? And so our bot family includes Cody. Cody is a bot that goes into the medical record and codes diagnoses. And that's important because then you can automate functions and flag patients who have heart failure, depression, chronic kidney disease. And so really important foundational piece in terms of getting the data that you need. And in primary care, you don't have coders who actually standardize data, so the bots actually are able to do that. We have Bernie, the bot. Bernie burns out, so physicians don't have to. And so Bernie does things like in COVID. Bernie's been documenting COVID vaccines. It saved one clinic 87 hours of time.
Wow.
documenting COVID vaccines. And so really, these are the tasks that we should get automation to do. And so Bernie's, doing a lot of other things and burning out, like preventative care, looking at test follow-up. So, if you order a lab test, have you completed the lab test, which is a college requirement? And so Bernie is looking to follow that up. And then we have Sharon, and Sharon shares data amongst disparate information systems. And so Sharon is working on sharing data between primary care and home care as a start. And so, that's a big problem as we look at sort of moving forward. Patients have to repeat their story multiple times. And so if we can use these bots to, essentially transfer information between one system and another, like swivel chair tasks, if someone is re-entering information into another information system, bots can very easily, copy and paste that information, put in the right spot. So as a physician, you have the information there at your fingertips in your system, and you're able to add to it. And when you add to it, in this case, the home care system would get updated with that information. So Sharon has been, developed to do that. So that's our family so far, and we're really looking at other opportunities to expand the family. We grow quite fond of these bots. The clinicians who we saved time, the 87 hours, they wanted to hug the bots because they were so impactful.
So, I mean, it seems like these tools are developed because you've identified specific needs as a physician and within the physician community. How involved are physicians in the procurement process, or were they before?
Yeah, absolutely. So and this is the going back to why I got into this space, is because physicians weren't involved
Hmm.
in these decisions, and they weren't involved in making the calls in terms of what would be valuable or not. So physicians, clinicians, patients are part of the procurement process. They're part of the definition of the problem, what outcomes we want, and then the evaluation piece, and then the ongoing iteration, right? None of these things is perfect. You need to have clinicians review these things and make sure that they're actually working for them. So we have clinical advisors that at the Health Center of Excellence that really dig into these things, evaluate these things, and make sure they're working. That voice is absolutely key through the whole process. That co-design is absolutely important, because we don't want technology to cause more burnout, and that's actually part of the challenge, is that electronic medical records are fantastic. Clinicians would never go back to paper, but they do add more administrative tasks. And so, these bots actually are able to sort of take those tasks off a clinician's plate, because clinicians have defined where the problems are and where they need help.
Hmm. That's really interesting. Um, I guess if you were to sell a clinician on the idea of becoming involved in these processes, like how would you pitch it to them? They say that I'm in an elevator with you. Give me a 30-second pitch as to why I should get involved.
Yeah. So I just like, what keeps you up at night, or what is keeping you longer at clinic? If I would have a discussion about, what time did you end your day yesterday? What time did you get home to, your family? And it really is, we can help with that, right? We can take, 30% of the work that you're doing, we can take off your plate. Does that sound good? And I think most people would agree that
Solid pitch.
that would be good. We can help you have more time to look after your patients. We can help you get home earlier so that you can be with your family. That's really what it's about. You don't need to do the repetitive routine tasks, because automation can do it. We're all used to, these virtual assistants on our phones, and we're all used to getting suggestions for what next to purchase, or maybe what next topping to get on your pizza. Maybe not pineapple for you. We're used to it in our other lives. So why not in healthcare?
Hmm. Hmm. So, I mean, in your point of view, what's the future of procurement in Canada? I mean, from my limited knowledge, I know in the States that they have different, I guess, healthcare authorities. They have different companies which administer a certain region. But I mean, we've got a similar thing here, except it's, federally or provincially administered. So what's the future in terms of collaboration or different processes that you can see that perhaps I or the listeners can't?
Yeah. So I think, we need to define what are the key problems we need to solve in healthcare, that we need to have these open procurement processes where startups and scale-ups can participate to solve these problems. And we need to make it the norm that we do these innovation procurements. Like that has to be the way that we move forward so that we include the startup community in these procurements. And then we need to hold ourselves accountable for the outcomes, right? We need to make things better, and have we made things better? And I'm, what I've seen is that if we take this more innovative approach, then we have a higher chance of succeeding because we're evolving things over time. So as our healthcare system looks to integrate care, get providers together, solve the problems coming out of during the pandemic and coming out of the pandemic, we need to take this more innovative approach with involving the startup community within this. And so what I hope people will see is more procurements where companies can participate that are smaller, where there is a clear path towards scale and spread, right? It's good to do a proof of concept, but then you need to be able to scale and spread. And so we need to set that as a standard. And I think we need to state that is the standard, that we are going to put things out there, engage our startups within that. And then if they're successful, we're going to support their scale and spread.
So, I mean, I think that's a wonderful vision in terms of being able to work with Canadian grown startups and patients to make sure that alongside clinicians, we're able to identify the best possible solutions to the needs at hand. But what pushback do you see coming? And perhaps how can we mitigate these headwinds?
Yeah. So, I think that there is, it's hard to change sort of a culture where we've been very risk adverse to trying things out, to engaging, in public-private partnerships. And, what I think is that we've seen during the pandemic, though, that we can do it, that we've had, crises in healthcare that we need to solve, and we've solved them. And we've done it, like in some cases, like overnight, in
Yeah.
some cases in a matter of just weeks, right? Versus, a 9-month sort of procurement, which at the end of the day, like you exclude a lot of companies that should participate in it. So, healthcare is in a crisis in many different areas. If you think about wait times, if you think about mental health and addictions, if you think about frail elderly and people sort of trying to stay in the home, we need to say, we need to solve these crises the same way that we have, worked on sort of managing the COVID pandemic. And if we can say that we have the same amount of commitment to solving these things, then I think, I think we'll be in a good state to move forward in some of the more nimble ways. And, they need to be transparent. They need to be fair, but I think we need a burning platform to actually move forward and do this, because we can struggle along and do the same things that we've done, but we're going to be spending more money. We're going to be not getting as good outcomes, and providers and patients won't have the time with each other because we're managing all these other things. So I think it behooves us to really look at us continue in the crisis state, not for the sake of sort of burning people out, but that we do have big healthcare problems that we need to solve, and we need to do it in the near term.
Hmm. And just one last question here. A lot of the tech that you've worked on is generally applicable to physicians' offices, managing burnout, managing these tasks that are repetitive and take quite a bit of time. But I mean, a lot of med tech that is known for med devices, for example, as well as perhaps pharmaceuticals. So where does this fit into this idea of involving startups in the procurement process? Does that blend over very well, or is your model only applicable for generalized tools that can be used by many physicians?
No, I think it's very similar. There's a lot of work on remote monitoring that happened during the pandemic, where devices were sort of given to patients and they could sort of monitor their symptoms for COVID or heart failure. And so I think there's a similar opportunity for those things. I think, it's within we're really looking at a system of care,
Hmm.
and that system of care needs, software to help share data and communicate. It needs hardware to capture data. I think the benefit is, a lot of hardware is already out there in terms of smartphones that we can sort of leverage, that people have, but the devices are so important because we're able to then sort of capture validated data and then leverage that data, to help with self-management for patients to, really look at decreasing the number of patients that go to hospital and more complex, higher cost settings. Devices are really the key to that.
So usually at the end of the podcast, we give our guests a chance to plug their pluggables. So Mohammed, do you know what time it is?
It's time to get to
Yes,
work.
it's also time for time for you to plug your pluggables. So what do you want to plug?
Yeah, well, I mean, I think, I think that patient-provider relationship is so key, and I think that, we need to move forward in that. That's what the eHealth Center of Excellence is doing, and so I'd encourage people to visit our website, eHealthCE.ca, at eHealthCE on Twitter and other social media. Follow us. Really, we'd like to engage in a conversation with you, clinician, patient, system stakeholder. We're here to support transformation healthcare system. This is a time like no other for us to do that, but it's going to be through engagement with people that we do that. So, this has been fantastic to talk about these things, but really it's the start of the conversation. As I said, we need to get to work and do more things, because there's so much more that we can do to make the patient and the clinician experience
You really
better.
know how to sell a call to action. All right, and you can find How It's Med at How It's Med on all the socials, as well as howitsmed.com. Thank you. Until next time.